Hi, you're watching Video Nurse. My name is Ime. I'm a registered nurse and a licensed mental health counselor in the state of Washington. Not here to diagnose anything or treat anything specifically here on this video, as people sometimes do call in their questions. But ironically today I want to talk about that very thing, which is telemedicine. Some of the new developments in telemedicine are really quite exciting, and I'm going to pull up something on my other screen here just to share with you how medicine is changing and what I think the future of medicine is going to look like. You'll probably also see this video on lockergnome.com/health under the title 5 Reasons Telemedicine Works. So I think the future of medicine really is going to go in this direction, just as you're watching this video. Of course, we have audiovisual platforms that allow people like myself, healthcare professionals, to be in contact with our clients and patients who are not in the same room with us. That could just be across the street, across town, across a state, and in the future we probably will develop more ways to effectively even do this internationally. Right now with international law that's a bit difficult because, for example, my licenses are only restricted towards doing practice in the United States and its territories. I'm not really allowed to go across that internationally. Of course, the Good Samaritan law definitely protects me no matter where I travel in terms of giving health care when it's an emergency situation. So here are those 5 reasons summarized, and you can read it in the blog as well, but the 5 reasons telemedicine works and why you really want it to work. Now, doctors, nurses, and mental health care practitioners, they can see patients using their smartphones and using the internet, all these platforms, and therefore the patient does not have to rely on their mobility or their functional capacities in order to get them to a visit. They can stay in their homes or their assisted living places, especially with the elderly, or in really remote areas. And so typically if a client couldn't be seen for X many months because they're in a remote area, they could be seen much sooner by a telemedicine professional who sits in an office and sits in front of a computer and then chats with that client and can diagnose and treat over the phone, giving standing orders as a physician or a nurse practitioner, for example, and then somebody locally can then do the actual services. So that's one reason. Another reason you really want telemedicine to work, and it does effectively, is that patients can select their specialists, and especially if those specialists don't live anywhere near them. But those specialists might be better at diagnosing their rare conditions than the staff that are often in remote towns. See, a lot of remote towns, in order to save money on staffing, are going to have less and less doctors, more nurses and nurse practitioners who may not specialize in these particular categories of which the patient needs to be seen. And so instead, using telemedicine, you could have direct access to these specialists. Number 3, telemedicine can save you a lot of time and money. And it's also saving the system that's getting taxed so much a lot of time and money. Now imagine you are just feeling miserable. You're honking your nose like a moose. And you're thinking, okay, maybe I've got H1N1, or maybe I've got a bad flu. How many times have you actually gone into the doctor, walked in to do a walk-in clinic, waited tons of time only to find out that you have a cold? Okay, and all you need is fluids, more rest, a little bit of over-the-counter medicine, and time. That's a real big bummer, and you wasted time and money. You drove maybe pretty far to get to a doctor, and you're also taking up the time of the clinic that could have been, done towards somebody else. What if you use telemedicine to go through the steps with a professional over the phone or over the internet and get an initial assessment so that you know if you need to be seen right away, or it was just that flu and that cold. And there are ways to determine that just over the phone. I know, I used to work as a triage nurse in a clinic, and that's exactly what we would do to make certain that people are not wasting time and money. Okay, number 4. Now, telemedicine can be good, and just as good, I think, as your bedside medicine. Now, I think that's especially true where you don't have to do anything particularly tactile on a person, so you can talk through, ask a lot of questions. And what's really cool about telemedicine is doing this over the phone. You could even get translation services set up side by side. So if the client speaks another language that you don't, obviously, it's not on the clinic to provide those translators, although in this country, of course, we do provide a lot of translation services. But doing that over the phone or over the internet is really effective. So I think that's a great choice. You don't always have to be in the same room. And what we're finding in a lot of the new recent studies is that people are saying that the telemedicine they're receiving is just as good as if the doctor or the nurse is in the room with you. My fifth point actually is related to that. I think that psychiatry and mental health probably has the most to benefit by telemedicine, and so do its patients, because imagine if you're just feeling really, really depressed or really, really anxious. How likely are you to actually cancel an appointment because you feel lousy, and that's actually the time you need to get in to see somebody? And you wouldn't be canceling your appointment if you felt lousy, because you could do this over the phone and you could actually have somebody talking you through what's going on and seeing if you need more care than to be suffering by yourself but feeling too icky to actually go in and see someone. So telemedicine's really going to revolutionize psychiatry and mental health visits, and already has transformed my practice. Now, outside the walls of my home office here that I'm sitting in, there's snow on the ground, and I'm not worried at all that any of my clients are going to cancel or can't come in because of snow, because they have computers and they have smartphones, and they can actually convert any of their sessions that week to seeing me here in my home office. Easy for them, easy for me. Nobody has to worry about, sliding down some hill in their car or being hit by somebody else, or slow public transportation because of the weather conditions. And that could be true anywhere. Even if you're on vacation or you're going to a remote area for a while, you can still have connection with most of your helping professionals if they get on the ball, if their towns have the broadband infrastructure to support telemedicine. So I want to know, what do you think? How would you feel about having a visit with somebody remotely, just like this? Me talking to you, you talking to me. Or any other healthcare specialist who you would normally not get to see unless you flew 1,000 miles or drove for hours and hours to go and see. How do you think that visit would go? Send in your comments and your ideas on the blog. It'll be lockergnome.com/health, and the title of the blog post is 5 Reasons Telemedicine Works. I'm Video Nurse. Thanks for watching.